And I feel like you could like add things that you know are really critical. Plus, you're so, Darlene, you're super smart.
Okay.
It's nice to have two.
Yes, I am all about the love.
Yeah.
Sharing the love.
Someone
Is it
commented
almost
that
done?
said your skin looks so nice, Laura. I forgot to tell you.
What?
Someone
Really?
said your skin looks so nice.
Oh, that's so nice. Thank you for saying that, people. You know, honestly, I'm going to tell you, I think it was that demo that we did with the
CO2?
fractional and the radio frequency, and then
Oh.
yeah,
Yeah?
Which
Yeah.
one? The micro, the profound?
it was a microneedling. We demoed it.
Oh, I see.
Are you guys ready? Oh, are we on? Okay, hi everybody, welcome back. We're so excited. Darlene and I are going to be doing something really fun. We have a wonderful patient here, and she is going to let us work a little bit, do our magic. So today we were looking for someone that we could do their under eyes, and actually, I'm going to go ahead and lift these really quick to show you your under eyes. She actually has really nice under eyes right now. I think Darlene has actually done a little bit of filler in there. But one of the things that we love to do for under eyes is Sublime. And you can do it before, you can do it after filler. It is a non-ablative radio frequency device. And it just heats that tissue up to a nice warm level where it just stimulates little collagen elastin, and it almost instantly makes the skin around the eyes look better.
Yes.
Do you agree?
Yes, I do. I love it.
So anyway, it is radio frequency, so it's actually really not dangerous on the eyes, but I'm just going to cover her eyes with a little bit of gauze just to, you know,
Therapeutic.
therapeutic,
So
and she can
good.
relax
Yeah.
and maybe kind of forget that we're on camera, because that's always a little bit intimidating, right? We're always like, oh boy. So, and then the next thing we're going to do, I'm sorry, let me go back. We're also going to be doing PRP on her. Now, originally I was going to do the PRP under her eyes, but I actually think if we do the PRP, I think the filler that Darlene had done on her earlier is beautiful. So I wouldn't really need to put any more PRP there. She might have some swelling if we do. So instead, we're going to inject some PRP into her face. One of the things that bothers her, she has a little bit of acne scarring here, and she has a little bit of hyperpigmentation. And what we know about PRP is that it's your body's own stem cells and growth factors. And what it does is it helps to heal damaged skin. It helps to brighten the skin. It can help it to
Stimulate collagen.
Stimulate collagen and elastin. I mean, athletes do it all the time in joints and all this kind of stuff, but then they found out, hey, let's try this in the skin, and we're just seeing beautiful, beautiful results with that. So anyway, we're going to get started with Sublime. We do use a little bit of ultrasound gel, and I am always a little bit generous with this. You too?
Yes.
Yeah, because it's you know, you want a lot of gel there. And so I'm trying to get Darlene to do half, and I do half. You want to do it?
Okay.
Okay, see, I knew she would. So Darlene's going to do that side, and I'm going to do. I'm sorry, but I love the idea of sharing a laser with someone, and I think
Okay,
it's so
I'll
fun.
do anything for you, Laura.
Oh, I love you so much. We have such a good team here. I know we sim, but we are so lucky because we always do help each other out, and I just, you know, I think it's kind of fun to see how we all do things a little bit differently, but the same, right? You want me to go first?
Yeah, sure.
Alrighty.
It's ready.
So, and we're on.
Do you like the auto too?
Let's do auto 1 to start, see how she feels. And then I'll zoom it up to auto 2. This one here. So we'll go auto on and ready. Okay. So this is such a simple device. I mean, I absolutely love it. I'm gonna dime doctor out. I do this on him almost every single week. He loves it so much because it almost immediately makes the skin look so good. So, and it's fast. It's really easy. We just apply it to the area. Are you ready? Okay, here we go. Oh, nope. It says foot switch. What? Why is there a foot switch?
Oh,
okay. Go there. We don't have a foot switch.
There we go.
All right. There we go. Okay. So that was just a fake out. We're really going to do it now. Here we go. 3, 2, 1. How's that feel?
Good.
Yeah. So it should feel a little bit warm. And we're going to go over the area multiple times until we really heat it up. What I'm looking for is just some generalized redness or erythema. And just, you know, looking for her to kind of go, oh, that's warm. And then once she does that, I palpate the area and I just check to see how we're doing. How are you doing? Okay?
Mm-hmm.
Okay. So again, So as you can see, she kind of pulled away. That's my cue. Oh, that might be getting kind of warm. So we want to warm that tissue up to where it's actually going to stimulate collagen and elastin. Okay, so I'll let it cool for a minute. This actually has a chill tip on it, so I'm going to kind of glide it over the area like this. Cool it down and back. The one thing I love about this one is you can really feel it. When you're having it done, you can almost feel the little bit of a pulse or twitch under the skin. And so a lot of times I can tell that was starting to get warm from, so I'm going to kind of cool it down again. So a lot of times it's almost like immediately tightening. You feel like the muscles in your face, and I think that's pretty fantastic. So here we go again. And I can see she's already pinking up very nicely. And that is my clinical endpoint. That is where we're going to stop. And I might even let Zarlene do the other side, then come back and do one more pass over on this side. So if you look closely, you can kind of see her eye twitching over the laser. So go. You doing okay still? All right.
Feels like a little massage, doesn't it? Some of my patients really like it.
Some love it.
Yeah.
I have patients who are like, you know what, it's actually kind of relaxing.
And you don't
she's
even...
like, it's hot. So again, I can kind of feel, and you can kind of see how pink she is over here. So I'm gonna let Zarlene go. And it's so fun because, again, like I said, we all have our own little techniques and things that we do, and we kind of all share it with each other, and we try to work on, you know, getting everyone. So see, look at Zarlene. She's gonna go fast. She wants to just go boom, 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 boom. And that's okay. So we, you know, and that's actually a good way to do it nice and quick so that she gets good erythema.
And again, for the people that are just joining, what does the machine do again?
So this is a radio frequency device. It's great for just stimulating collagen and elastin. It's non-ablative, tightens the skin, helps with fine lines and wrinkles. It brightens up your eyes a little bit. So it's just a really nice way to freshen your under eyes very quickly. It actually can be used in other areas besides the eyes. We use it in the perioral, so around the mouth. I've done full faces with Sublime. It takes a little bit longer, but it just tightens up the skin so you immediately look refreshed and gorgeous. So sometimes I even tell patients, like, if you have a big event, you could do this the day of the event.
Okay.
And your skin's gonna look so fresh and so glowy that night. So let's say you had an event that night. That morning you come in, you do a Sublime, and that night you're gonna look just a lot, your skin's just gonna glow. So anyway, as you can see, so she just finished her side, and I'll go ahead and do just like her. Let's see here, I'll steal your gel.
I go a little bit.
Yeah, faster. So I can go ahead and do kind of very similar. And again, like I said, I can already see she is really red here, so I don't know if I want to go too much more because she's already going out to me. So I like the way Zarlene does it. She just does this 1, 2, 3, 4, 5, and then she glides it back up, and you use a little gel there. I'll just use my tip for that. Good. How are you doing? Okay?
Yeah.
All right, again.
Is there any restrictions in regards to face washing, makeup, etc. after the procedure?
No, with this one, like I said, it's non-ablative, so there's no downtime. I mean, you might be a little bit more swollen, but you would have to be someone that looks at your face every single day to notice the swelling. But in terms of restrictions, with this one, I really don't restrict anything. I would even say they could still use their retin-A. What do you think?
Yes, but I wouldn't exfoliate as vigorously as I would if I weren't doing a laser. So just hold off a little bit on it.
I'm going to do one more pass. I want it really hot. The goal is, you know, kind of like these body devices where they're heating up the skin. It's the same kind of thought process, that heating it up and then it just tightens it up. So there you are. So let her go again.
One more time, okay?
And while Zarlene's doing that, I'm going to go ahead and drop her PRP because we already drew her blood. I think Jose took a photo of that earlier. So we have it all ready to go. And this is what's really fun. I love showing how this all works too on camera, because basically when we originally drew it, it was just all blood there. It just looked like blood. Now, after we centrifuge, 5 minutes, it's very fast spinning motion. It pulls the red blood cells down, and what we have up here are very good, rich growth factors and stem cells. That's PRP. And I just kind of turn it around, and you can kind of see the little stem cells in there kind of spinning around, and just kind of fun to do. So we're going to draw these up. And I'll let Zarlene finish up there while I'm doing that.
Yeah, just let me know when you're done.
Okay. So now this has become kind of a popular technique, this PRP. People call it, in other places, they'll call it like a vampire facelift or something like that. I think someone patented that name, so we're not allowed to say that, but whatever. It's essentially, it's exactly the same thing. It's literally taking your own stem cells, your own growth factors, injecting them into areas where you want to renew the skin and just have this really bright, fresh appearance. And I will tell you, I have so many patients that just absolutely love this, especially for the under eyes. That's one of the areas I really wanted to demo today, because I think that sometimes not everybody's a good candidate for fillers under their eyes, because it can make them look more tired. But if they do PRP, initially they'll have some swelling, but it immediately brightens the skin of the eyes, which I think is really kind of cool. So that's where one of my favorite places to do it. And I think a lot of you probably have seen, I did a video I did it with cannula, and that's not the only way to do it. You can do little micro injections. There's so many techniques that are really, really fabulous. I sometimes use the cannula because I don't want the patient to bruise. How about you, Zarlene?
Oh, yes.
Any techniques?
But it's also patient preference. I have some patients.
Yeah, that like just serial injections versus...
If they don't like the idea of the needles going towards their eyes, then
yeah,
the cannula would be more appropriate for them if they're afraid of needles particularly.
Or if there's someone who's really prone towards bruising, because you know, some of our patients are taking aspirin or blood thinners, and in a lot of cases, some people would say, well, you know, you're not really a candidate because you're going to bruise. But cannula does help prevent some of that bruising, so they can become candidates, and we can do that cannula in those areas where they may be more likely to bruise. So you can see how beautiful and fresh. If you look closely at her skin, you're going to see just a little bit of that erythema or redness around the eyes. And you know, she may have a little bit of swelling because she, like I said, she had some filler. How long ago did they do the filler, or how long ago did you?
A few months.
So it's been a few months, but you know, this.
She had some numbing too.
Yeah, so she's just a little bit swollen right now, but it looks really good. So the next thing we're going to do is we're going to I prefer, when I'm doing PRP, I like to inject it first. And I like to inject it into areas where patients want a little bit of a lift. So for example, here you can see she has just these little tiny scars. I'm actually going to inject it into the scars that she has. Then I'll do the Derma Pen, which is rolling the platelets on there. I'm going to give one to Zarlene. She can do that side, and I'll do this side. And I love the idea of tag teaming things, because I think, one, it allows everyone to see different styles. Zarlene is an amazing injector. Every time I go to inject someone, they're like, oh, the other nurse, she taps my cheek or something when she injects me, and I'm like, oh, that's Zarlene. So you can see, as I'm injecting, just little tiny blebs into the tissue. I'm gonna kind of just show here. It almost immediately brightens the skin and it lifts that scar up. It's kind of the same thing, kind of the same idea as doing like little filler blebs, but it's going to absorb and you're not going to have the filler result.
Now, does it help with the dark circles?
That's one of my favorite reasons to do it, because we do have a lot of Middle Eastern, Hispanic, Pacific Islander patients. And again, not everybody is a good candidate for filler. So in this case, I tell them, try PRP. Because it just brightens up the skin and it helps with those dark circles under the eyes. So you can see, again, just micro injecting into the areas where she has a little bit of...
I like to use it as my lubricant also, Laura.
Yeah.
Instead of like vitamin C or the hyaluronic acid.
And I think it's totally appropriate. You can actually use both. You know, sometimes I'll do the PRP and then I'll put the HA or the vitamin C right over it too, because then you're going to get that more superficial glow, and then this one's going to go deeper and give you that deeper glow. So she's got a little bit of dyschromia here around her lip. I'm going to inject this, kind of a little painful. Nice deep breath for me. Oh, just got myself. That's fun. Platelets in the eye. There we go. And just again, seeing it brighten up the skin. I do a little along here, and then I'm going to try to save a little bit. I'm sorry, hon. Just a little on this scar here. Just kind of.
When do you see full results?
So usually we offer these in packages of 3. So you can do the package of 3. I have patients tell me they see results at least 1 week afterwards. Their skin just looks marvelous. They're glowing. It looks amazing. So again, great treatment if you have a big event coming up. You don't want a lot of downtime. So we'll save a little bit of this for the top, and then we're going to glide the Derma Pen right over it. So you can see I'm just going to put that on there. And we're going to start with our Derma Pen.
I have a little bit more.
Okay, good. So I'll let you kind of
more lube.
on the forehead. I'm a little bit more gentle. I'm sure you are too. Where I don't like to go as high with the Derma Pen.
I usually do 0.5.
0.5. Let's do 0.5. I love
forehead.
that. So I'm gonna. I don't want to lose
And then
this
I do
PRP.
up to 2 on the
Okay,
cheek.
here we go.
Do you guys prefer the Derma Pen versus the Derma Roller?
Yes,
In
I do.
certain areas, it depends on the area of the body. So, for example, I have some patients who like to have it done in the abdomen to help stimulate some of that loose skin that they have, or even for like stretch marks. So I use the Derma Roller as opposed to the Derma Pen, but I like the Derma Pen
Put
for
a
the
little bit of
yeah,
PRP
sure.
on there. I'm gonna keep talking. Don't stop.
Yeah, I like the
just
Derma
need a
Pen
little
for
bit
the
of
face.
lube on there. And if you look closely at her skin, you can just see how bright it already looks just from, you know, and of course some of that's the serum, but it's just that those platelets really get in there and just really make the skin look so gorgeous and so bright. So the majority of her little acne scarring is kind of over here in the corner, so we'll focus over here. Again, you know, just
I have
going-
more too.
Yeah, maybe we'll save a little bit for the others. Here we go. You do have more. Good. I injected a lot, I guess.
Is
Okay.
she known for this?
Yes. So
Just topical.
Yep, just topical. I mean, we have in the past done injections for patients who have. See how that skin is so
Beautiful.
tight? I just want to show you before because that's just from injecting the PRP. But look at how it's just pulled that skin. It's so gorgeous and so tight. So it kind of keeps that feeling to it. So I'm gonna go again. How you doing? Okay.
How do you feel? Any pain?
Not right now.
Pretty good. Put the rest of it.
All over. I'm gonna even do a little on the nose. It's kind of gonna tickle a little bit. Sometimes it makes me feel like sneezing when I do the nose. So if you have to sneeze, forewarn me, okay? So this is my favorite time of year. Who else loves Christmas as much as me? I mean, it's just such an awesome time of year. Everybody, you know, it's that time of giving. That's why we love the Day of Beauty. Christmas Day of Beauty is probably the best one to come to.
Alrighty.
So for those of you who aren't here yet, come down because we're live, right? Are we live?
Or live?
Yeah, so for those of you who are like, oh, should I go? You should go because you're going to get a great deal. Plus, you're going to get to see all of our beautiful decorations, our staff, everyone's here. We just like seeing you. We just want to kind of talk with you and kind of like hang out and you know, it's just a good way to kind of get, if you have any questions about anything we do, we'd love to have you here.
And typically, how long do you like to leave this on, Laura?
I tell the patients if they can leave it on for an entire day, that's best, but 8 hours. I have some patients who are like, I just can't do it because I'm going to be honest, after the, I'm going to go a little bit deeper on the cheeks here. Let's go one. They're like, you know, it kind of has a weird smell or kind of the tight, your skin becomes really, really tight after about an hour or so, and sometimes for them that's just not comfortable, so.
But the longer you can leave it on, the
The
better.
better, absolutely. Same thing with the scalp, and you know, Zarlene is kind of our hair transplant guru here. So, you know, with the scalp, how long do you usually tell them to do it?
For the scalp, I
Yeah.
tell them to leave it as long as they can.
Yeah. So, I mean, a day if they can, 2. Do you go 2 days? Okay. All right. I'm going to stop there. We're going to just massage the rest of it into the skin. And, you know, we are, how did that get there? Just going to kind of massage it in so she can just, you know, she'll probably start to feel like the tightness kind of kick in. But at least she's, you know, when she leaves here, it's not going to look like we, you know, beat her up too bad. Sorry. Although I have had a few patients that leave here and I'm like, wow. And they're like proud of it. They're like, yeah, I can't wait to tell my friends. Okay. So that is it. That is it. She did such a great job. How was it, I mean, in terms of pain?
Well, the injection was
A little more painful? Yeah. But after that?
it was okay.
Okay, great.
Not too bad.
Well, thank you, everyone. If you have any questions, stop myself, Zarlene. You can
Laura.
stop our wonderful patient. She's probably going to be leaving soon, but you can always ask her if you have any questions or have a look at her. She just already is just glowing so beautifully. So anyway, we'll see you out there.
All right.
Okay, thanks for